The essential vitamins for diabetics. What you need to know for better health and blood sugar control. Managing diabetes involves more than just monitoring blood sugar levels, staying active, and managing carbs. There's another crucial aspect that often gets overlooked: vitamin deficiencies. Vitamins are essential nutrients that our bodies need to function properly, but many people, particularly those with diabetes, are not getting enough of the vitamins they need. This article will explore 3 essential vitamins: vitamin B9, folate, vitamin D, and chromium, and how they can significantly impact blood sugar control, insulin sensitivity, nerve health, and overall well-being. While diabetes management often revolves around regulating blood glucose levels and maintaining a healthy diet, deficiencies in certain vitamins can worsen symptoms and contribute to complications. For diabetics, understanding the connection between these vital nutrients and health outcomes is key. If you feel tired, struggle with focus, experience nerve pain, or notice slow wound healing, these may be signs of a deficiency in crucial vitamins. By incorporating foods rich in these nutrients into your diet, you can improve your diabetes management and overall health. This article will dive deep into these vitamins, their importance for diabetics, and the best ways to incorporate them into your diet. By the end, you'll have a better understanding of how these vitamins can support your body, improve energy levels, protect nerve function, and reduce the risk of complications. Vitamin B9, folate, vital for cellular and nerve health. Vitamin B9, also known as folate or folic acid when synthetically produced, is essential for producing red blood cells and supporting the body's metabolic functions. For diabetics, folate has an even more significant role. It is vital for nerve health and cellular regeneration, processes that can be disrupted by high blood sugar levels. Folate is responsible for breaking down homocysteine, an amino acid that can cause damage to blood vessels, nerves, and kidneys when present in high levels. Diabetics, particularly those with kidney complications or who are on metformin, are more likely to suffer from a folate deficiency, which can lead to severe complications. Over 40% of people with diabetes have low levels of folate, with the deficiency rate being higher in those using metformin, as this medication interferes with folate absorption in the body. The symptoms of folate deficiency can often resemble those of diabetes itself, including mood swings, fatigue, poor focus, and tingling in the feet, making it difficult to distinguish between the two. These early signs often go unnoticed, but if left unchecked, folate deficiency can worsen, causing mouth sores, pale skin, dizziness, memory loss, muscle weakness, and worsening nerve pain. More concerning, long-term folate deficiency leads to increased levels of homocysteine in the bloodstream. This accumulation can damage your blood vessels, nerves, and kidneys, ultimately speeding up the progression of diabetic neuropathy and kidney disease. Studies show that folate helps reduce nerve pain and protects against the damaging effects of high blood sugar. Folate is also crucial for neurotransmitter production, supporting mood, memory, and focus, which are particularly important for people with diabetes who often experience cognitive difficulties. Foods that are rich in folate, such as beef liver, spinach, asparagus, avocado, and lentils, are excellent sources for diabetics. Unlike folic acid supplements, which are often poorly absorbed, real food-based folate is more easily utilized by the body. When incorporating folate-rich foods into your diet, it's essential to pair them with healthy fats and protein to help stabilize blood sugar and improve nutrient absorption. Vitamin D, a critical hormone for immune function and blood sugar control. Vitamin D is another nutrient that plays a crucial role in diabetes management. Unlike many other vitamins, vitamin D is actually a hormone that controls the function of over 2,000 genes in the body. This powerful nutrient helps regulate insulin sensitivity, reduces inflammation, supports nerve function, and plays a vital role in immune health. Unfortunately, a deficiency in vitamin D is common among people with type 2 diabetes, with studies showing that about 80% of diabetics have insufficient levels of this essential nutrient. The signs of vitamin D deficiency are often subtle but can severely impact daily life. Diabetics who are low in vitamin D may experience fatigue, muscle pain, difficulty controlling blood sugar, mood swings, and poor sleep. Vitamin D helps insulin work more effectively by improving insulin sensitivity and allowing your cells to utilize glucose better. Without enough vitamin D, the body's ability to process glucose declines, and blood sugar levels become harder to control. Additionally, vitamin D has a profound impact on the immune system, which is particularly important for diabetics. High blood sugar levels can weaken the immune system, making it more susceptible to infections. By boosting the immune system, vitamin D helps protect against illnesses and speeds up recovery from wounds or infections, which diabetics are more prone to. Moreover, vitamin D deficiency has been linked to various complications in diabetics, including nerve damage, retinal issues, and kidney disease. To combat vitamin D deficiency, it's essential to increase your intake of foods like fatty fish, salmon, mackerel, sardines, fortified dairy products, eggs, and UV-exposed mushrooms. Vitamin D is a fat-soluble vitamin, so pairing these foods with healthy fats such as olive oil or avocado can enhance absorption. Regular exposure to sunlight is also an effective way to boost vitamin D levels naturally, as sunlight triggers the skin to produce vitamin D. For those who have trouble getting enough vitamin D through food and sunlight, supplements are an effective option. The most beneficial form of vitamin D is D3, which is better absorbed and lasts longer in the body than D2. The recommended daily dose for adults is 2,000 to 5,000 IU, especially for diabetics who may have higher needs. Vitamin D supplements should ideally be taken with food to improve absorption, particularly alongside vitamin K2, which helps regulate calcium levels in the body and ensures that calcium stays in the bones rather than accumulating in the arteries. Chromium, enhancing insulin sensitivity and reducing sugar cravings. Chromium is a trace mineral that plays a pivotal role in improving insulin sensitivity and helping the body process glucose. For diabetics, chromium supplementation can be a game changer, as it helps insulin function effectively by enabling it to transport glucose into cells. Without sufficient chromium, insulin becomes less effective, and glucose levels build up in the blood, exacerbating insulin resistance and blood sugar instability. Diabetics often have low chromium levels, as high blood sugar increases chromium excretion through urine. Studies show that diabetics can lose up to twice as much chromium as people without diabetes. This makes chromium supplementation particularly important for diabetics. When chromium levels are low, the body struggles to maintain stable blood sugar levels, leading to energy crashes, hunger, and increased cravings for sugary foods. Supplementing chromium can help stabilize blood sugar levels, reduce sugar cravings, improve energy levels, and even support weight management. Research has shown that chromium supplementation can lower fasting glucose levels, reduce A1C, and even improve insulin sensitivity. As a result, adding chromium-rich foods like broccoli, turkey, whole grains, and green beans to your diet, or considering chromium supplements, can be highly beneficial for managing diabetes. The most effective form of chromium is chromium picolinate, which is well absorbed by the body. A typical daily dose of 200 to 1,000 micrograms is recommended, depending on individual needs. Supplementation with chromium picolinate can help restore proper insulin function, reduce the risk of complications associated with diabetes, and stabilize energy levels throughout the day. The role of vitamin E, protecting the body from oxidative stress. Vitamin E is an often overlooked nutrient that plays an essential role in protecting the body from oxidative stress and inflammation, both of which are common in diabetics. Oxidative stress accelerates aging, damages cells, and increases the risk of complications like heart disease, nerve damage, and vision loss. For diabetics, maintaining adequate levels of vitamin E is crucial, as it helps combat the damage caused by high blood sugar and supports overall cellular health. Vitamin E is a powerful antioxidant that protects against oxidative stress, particularly in the nerves and blood vessels. Studies suggest that adequate vitamin E intake can help slow the progression of diabetic neuropathy, reduce pain, and improve nerve function. Additionally, vitamin E supports heart health by preventing the oxidation of cholesterol, which leads to clogged arteries and poor circulation, a significant concern for diabetics who are already at an increased risk of cardiovascular disease. To get enough vitamin E, you can consume foods such as almonds, sunflower seeds, spinach, Swiss chard, and avocado. These nutrient-dense foods are excellent sources of natural vitamin E, which is better absorbed by the body than synthetic versions found in some supplements. Vitamin E is fat-soluble, so pairing it with healthy fats like olive oil or nuts will improve absorption. Conclusion: a holistic approach to diabetes management, Incorporating these essential vitamins, B9 and chromium, into your daily routine is vital for managing diabetes and promoting long-term health. Vitamin B9, folate, helps protect against nerve damage, supports healthy cell function, and reduces the risk of complications. Vitamin D plays a crucial role in regulating insulin, boosting immunity, and maintaining overall well-being. Chromium enhances insulin sensitivity and helps regulate blood sugar levels. By maintaining adequate levels of these vitamins, diabetics can improve energy levels, support nerve function, protect against heart disease, and reduce the risk of long-term complications. A balanced diet rich in these vitamins, along with regular medical checkups and lifestyle management, is essential for controlling diabetes and leading a healthy, vibrant life. If you suspect a vitamin deficiency, consult with your healthcare provider to discuss testing and supplementation options. By taking charge of your health, you can make meaningful progress toward better diabetes management and improve your quality of life.